Welcome to our channel. In this video, we are going to discuss the major issues you may encounter when holding in your urine for too long. Holding urine for an extended period might seem like a harmless act, especially when you're caught up in work, traveling, or simply too busy to take a bathroom break. But this seemingly trivial habit can have significant consequences for your health. The human body is designed to signal when it's time to relieve the bladder, and consistently ignoring this signal can lead to a variety of health issues, some of which might surprise you. Imagine your bladder as a balloon. When you drink fluids, the balloon fills up gradually. Your bladder can comfortably hold about 400 to 600 milliliters of urine before you start feeling the urge to go. This is when your body sends a signal to your brain, indicating that it's time to find a restroom. If you ignore this signal, the bladder continues to stretch, accommodating more urine than it ideally should. While your bladder is flexible and can expand, it wasn't designed to hold urine indefinitely. The first thing that happens when you regularly hold your urine for too long is that your bladder muscles start to weaken. The bladder is a muscular organ, and like any muscle, it needs to be exercised properly to function well. If you habitually delay urination, your bladder muscles become overstretched and lose their elasticity. Over time, this can lead to difficulties in fully emptying your bladder, a condition known as urinary retention. Urinary retention can be uncomfortable and, in severe cases, may require medical intervention. Furthermore, when urine is retained in the bladder for too long, it becomes a breeding ground for bacteria. Normally, when you urinate regularly, you flush out bacteria from your urinary tract, keeping it clean. However, when urine is held for extended periods, the bacteria multiply, increasing the risk of developing a urinary tract infection. UTIs are not only painful, but can also lead to more serious complications if left untreated. Symptoms of a UTI include a burning sensation during urination, frequent urges to urinate with little output, cloudy or strong-smelling urine, and even pain in the lower abdomen. One might think that holding urine is an isolated action affecting only the bladder, but it actually has repercussions for other organs, particularly the kidney. The urinary system is intricately connected, and when the bladder is too full, urine can back up into the kidneys through the ureters. This can cause a condition known as hydronephrosis, where the kidneys become swollen due to the accumulation of urine. Hydronephrosis can lead to kidney infections, which, if recurrent or severe, can cause long-term kidney damage. The kidneys are vital organs responsible for filtering waste from your blood, and any damage to them can have serious implications for your overall health. Another consequence of holding your urine for too long is the discomfort and pain it can cause. As the bladder stretches beyond its comfortable capacity, you may experience abdominal pain and pressure. In extreme cases, the bladder could even rupture, though this is rare and typically occurs only under extreme conditions. The discomfort isn't limited to the bladder alone. You might also feel pain in your lower back, sides, or pelvis as the pressure builds up. This pain can become a significant distraction, affecting your ability to concentrate and perform daily tasks. In some situations, individuals who frequently hold their urine may develop a condition known as overactive bladder. Overactive bladder is characterized by a sudden, intense urge to urinate, often leading to involuntary leakage of urine. This condition can be quite distressing and impact one's quality of life. Those with overactive bladder may find themselves needing to visit the bathroom multiple times during the day and night, which can interfere with sleep and daily activities. While overactive bladder can be managed with lifestyle changes and medication, it underscores the importance of listening to your body's signals and not delaying urination unnecessarily. It's also worth mentioning that holding in urine can affect your mental and emotional well-being. The constant discomfort of a full bladder can make you irritable and anxious. Your focus shifts from whatever task you're engaged in to the nagging need to relieve yourself. This can decrease productivity and increase stress, particularly in situations where finding a bathroom is difficult. Over time, the stress of constantly managing this discomfort can take a toll on your overall mental health. For those who believe that holding in urine is a way to train their bladder to hold more, it's important to dispel this myth. While bladder training is a legitimate method used to manage conditions like overactive bladder, it is done under medical supervision and involves gradually increasing the time between bathroom visits, rather than ignoring the urge to urinate for extended periods. Improperly holding urine without a medical plan can do more harm than good, as it puts unnecessary strain on your bladder and urinary system. So, what should you do if you find yourself needing to hold your urine often? First and foremost, make a conscious effort to prioritize bathroom breaks. If you're in a situation where bathroom access is limited, such as during a long drive or a meeting, try to plan ahead. Use the restroom before your event or journey, and take breaks when possible. Staying hydrated is important, but be mindful of your fluid intake if you know you'll be away from a restroom for an extended period. It's also helpful to be aware of what might be causing your frequent need to urinate. If you're consuming large amounts of caffeine, alcohol, or certain foods that act as diuretics, cutting back on these could reduce your trips to the bathroom. However, if you notice that you're frequently needing to urinate or experiencing pain when you do, it may be time to consult a healthcare professional. There could be an underlying condition, such as a UTI or overactive bladder, that needs to be addressed. While it might seem convenient to hold your urine for long periods, it's not worth the potential risks to your health. From bladder stretching and weakening to the increased risk of infections and kidney damage, the consequences can be serious. Listening to your body's signals and taking regular bathroom breaks is a simple but effective way to protect your urinary and overall health. Remember, taking a few minutes to relieve yourself is far better than dealing with the long-term effects of holding it in. If you found this video useful, like and share this with your friends and subscribe our channel for more useful videos.